All right, buddy. Today I want to talk to you a little bit about elbow pain and what we do to treat it in our office, and some things that you can do at home to kind of combat that and expedite the process once you start doing care at the Chiropractic Center. So elbow pain is most often caused by overuse, chronic repetition, where if you're in the office setting, you're typing for 8-10 hours a day, so every time you go into flexion extension with that wrist and forearm, you're putting stress on the muscles and tissues on the lateral and medial side of the elbow. Tennis elbow, golfer's elbow, also known as lateral epicondylitis and medial epicondylitis respectively. That's often used with sporting injuries where there's chronic repetition with that golf swing. If you're taking divots constantly, it's putting stress on that medial side. And then with tennis, with backhands, always stressing the extensor muscles on the back. So what we use in our office to treat this is with active release technique. ART is used to treat, identify, diagnose, and treat the muscles. So we're actively breaking up the scar tissue that's formed over time. So that's going to restore the mobility and motion of the muscles and soft tissues within that joint. Some stretches you can do at home just for working on the flexor side, so especially on that medial side. Extend those fingers, keep the elbow straight. And you want to be sure to lock out that elbow just because a lot of muscles come up past the joint. Hold that about 10-15 seconds and then flip it around for the extensor side or the lateral aspect. And again, 10-15 seconds. And you can try to aim for doing that once an hour. That'd be a great goal. Some mobility you can do is called the teacup position. So if you start with that elbow close to the side, palm up. So imagine you have a cup of tea, can't spill it, right? So you're going to internally rotate, keep that wrist flat, and extend all the way. And you should feel a pretty good stretch in that elbow. And then come back around and externally rotate that shoulder all the way. And do that about 10-15 times. And again, ambitious goal is once an hour, but if you can do it a few times a day, that'd be great. If you have any questions at all, you can call us at 303-300-0424, and we'll get you out of pain. Thanks a lot.